Hi everyone, good morning. Our topic today is about bowel elimination. This is very familiar to all of us since every human, every person will remove his or her bowel. Now, here in this topic, we are going to discuss how does the process of ingestion, digestion, egestion, which is defecation, how to remove dirt, the food that we eat, the water that we drink, so it will undergo with the process of elimination. But before that, I'm going to share you a word of thought. There are so many things we do, from treatments and antibiotics to laughter, prayer, and collaboration, but our purpose is to facilitate healing. That is according to Winslow. Now, in this topic, you'll be able to find out and understand what are the learning objectives. So, surely, after this discussion, at least every healthcare nurses will be able to describe what are the normal bowel elimination process, and you will be able to explain, once asked by your patient, what are the AIDS-related changes that affect elimination. You will know how to assess what are the critical elements of bowel structures. You will be able to discuss what is the normal bowel elimination and assess what are the critical elements of bowel function. You will be able to describe and understand what are the expected outcomes of nursing intervention that promote normal elimination. And the last but not the least, this is one of the most important function of the nurse, is you will be able to make nursing care plan and do nursing management interventions for any alterations in bowel function utilizing the nursing process. So here, as you are going to take a look with the physiology of elimination, we are going to review. Now, we have here the what we call as ingest, the food, the water, and then it will be digested, it will be absorbed, it will assimilate, and then it will be excreted, or it will be ingested through the process of defecation. Now, if you are going to see the other structures, that now the gastrointestinal tract is any food, any fluid that you are going to drink, it will undergo, it will pass through the mouth, and then through digestion, it will be absorbed, and after absorbing the waste materials, that will be ingested or that will be defecated, and through the accessory digestive organs used, it will help in the process of digestion. Now here, if you are going to take a look to the structure, we have the salivary glands, we have the esophagus down to, and then we have the organs, the liver, the gallbladder, we have the stomach, we have the transverse colon, we have the descending colon, then we have the pancreas, the ascending colon, and then we have the small intestines. Now, a combinations of duodenum, jejunum, and ileum, and then down through the cecum, and then going to the sigmoid colon, and then for the process of digestion, it will go out through the anatomical structure, which is the rectum. Now, here, class, the GIT, bowel elimination, is composed of the stomach, the small intestine, the large intestine, and the rectum. While the small intestine, it absorbs nutrients. The large intestine, it absorbs fluid and the remaining nutrients. While the distal portion of the large intestine, it will collect and stores the remaining solid waste until elimination occurs. So, in the anal sphincter mechanism, as you can see, we have the rectal sphincter, we have the anus, the structure, and then this anal sphincter mechanism, class, is 80% of intake that is not absorbed by the body is excreted from the bowel within 5 days following ingestion. So meaning, you are going to eat food, you are going to drink, how many percent? 80% of intake is not absorbed by the body. So normally, it will be excreted, it will go out and removed outside the body through the process of ingestion. So we have the defecation, the evacuation of stool from the rectum, and then what are the factors that will affect elimination? Number one, we have the AIDS. 18 months of AIDS start the bladder, bowel control, and is typically not mastered until age 4. We have 2, diet. Adequate intake of fluid and food rich in fiber. This will affect elimination. We have 3rd, exercise. This will enhance muscle tone, leads to better bladder, sphincter control, or the peristalsis. It is also aided by activity. So that's why every person suffering from any constipation, etc. or something, now who has problem about bowel elimination, they are advised to do exercise, mobility. Now this diet, this is very important. And then 4th, medication. Any cardiac clients are commonly prescribed diuretics. What is diuretics? This will help now in removing fluids outside the body. Now any toxic, any waste materials outside from the body, which is needed to be removed now because it will contribute problems. This will increase urine production if diuretics in a form of medication will be prescribed by the doctor. Then we have the antidepressants and antihypertensives may lead to urinary retention over the counter. Now any cold remedies, especially antihistamines, may also result in urinary retention. So that's why diuretic is very important for this one. It's useful. Now, bowel elimination, there are common alterations or any impaired, common alteration. Number 1, we have constipation. Colonic constipation is the infrequent and difficult passage of hardened stool. So that is constipation. Second, common alteration in bowel elimination is we have diarrhea. This is a passage of liquefied stool. Increased frequency and consistency represents a change in bowel and person bowel habits. So normally, every person, individual, must eliminate bowel at least 1 to 2 times a day. So third, we have the fecal incontinence. What is this? This is involuntary loss of stool of sufficient magnitude because of dysfunction of the anal sphincter. Now, if a problem like what we have mentioned, constipation, let's say for example, you are going to formulate a nursing care plan with this in order for you to manage now using the nursing process. You are going to formulate this through the aid of the what we call as ADPI. Now, assessment, you are going to make a nursing diagnosis, you are going to plan, you are going to implement, and then you're going to evaluate if that's effective, not effective, or it needs to be restrained. In other words, others will say, is it meet, partially meet, or we need to restrain? And then you are going to do reassessment again, and then you are going to implement and do evaluation. Now I have a nursing care plan here, sample. So if the patient has the problem in bowel elimination, example the constipation, you are going to make a nursing care plan with the use of the nursing process. The first, you are going to assess. In assessment, there are subjective and objective. Basically, patients suffering from constipation, they are going to complain subjectively. They will say, I am not removing bowel even once a day for 2 or 3 days now until now. I suffered from constipation. And the objective is you are going to find out the abdominal pain by observing the face, grimacing face. And we have the what we call this urgency and cramping of the stomach. You are going to check for altered bowel sounds, the vital signs taken, and then you are going to record basically the temperature, the pulse rate, the blood pressure, and the respiration, because these are indicators to patients suffering from a problem. Now, in diagnosis, the problem is constipation. You're going to connect with the etiology and then with the evidence or manifestation. So here, constipation related to decreased dietary intake. So as manifested, evidence, you are going to check with your objective, you're going to connect that one. And then, what is your plan? If you are going to make a plan, be specific, measurable, attainable, and realistic. So if you're having a duty, 6 hours to 8 hours or 6 hours, you are going to state that after 6 hours of duty, nursing intervention, the patient will be able to establish or return to normal pattern of bowel functioning. And then, what are your interventions? The first independent interventions you're going to do is you are going to determine the stool color, the consistency, the frequency, and the amount. You are going to auscultate the bowel sounds. In every intervention you are going to do, be sure you have the rationale. Now, what's the reason why you are going to auscultate the bowel sounds? You're going to check the bowel sounds because generally, if there's decrease in bowel sound, there is constipation. You're going to encourage your patient by taking more fluid, so at least 3,000 ml per day. That's normal. Now, within cardiac tolerance, you're going to recommend avoiding gas-forming food. One example of gas-forming food is root crops. Now, food coming from what we call as root crops. So here, you're going to assess for any perennial skin condition, frequently change or any skin breakdown. You are going to discuss also what is the importance of using stool softeners. If there are prescribed by the doctor or the physician, you are going to administer that one. Surely, every medications you are going to administer to your patient, you are going to study that out. Once questioned by the patient, you will be able to answer what's the purpose, what are the mechanism actions of that medication. And we have the last under nursing process is you are going to evaluate. So based from intervention, did your goal or plan met, partially met, or if not, you are going to reassess your patient and then re-implement until the patient is okay already. So class, that is all about bowel elimination. We discussed an example of how to make nursing care plan with the problem of constipation. So aside from this video lecture that we have done, stay in tune and then study more. If you have time, you are going to check in the hybrid library, browse on the internet. Now, what is all about bowel eliminations and nursing management? What are the things need to be done? So class, all for now. Bye-bye and thank you. Best wishes.